This is The Future Of, where experts share their vision of the future and how their work is helping shape it for the better. I'm Alex Foote. With more than 30,000 Australians living with multiple sclerosis, understanding this complex disease of the central nervous system is more important than ever. Sadly, the majority of people with MS face the unpredictable waves of relapse-remitting MS, or RRMS, which brings both neurological challenges and periods of remission. In this episode of The Future Of, we chat with Dr. Virginia Lamb from Curtin University. Her work aims to turn the tide against MS by not just pausing, but potentially reversing its progression, offering hope for improved quality of life for those affected. Well, hello, Dr. Virginia Lamb.
Hi.
Thank you for joining us today.
Thank you for having me.
So I guess I'll just start off with a real baseline question. Could you explain what multiple sclerosis is and how it affects the body?
Sure. So multiple sclerosis, I'll refer to it as MS for the rest of the podcast.
Yep.
It refers to a chronic neurodegenerative condition. It affects mostly women with 2-to-1 ratio and mostly young females between 20 to 40 years of age. MS is essentially categorised into 4 different types of categories. So there's clinically isolated syndrome, there's relapse-remit MS, so RRMS. There's also 2 types of progressive MS, so it's either primary or secondary. So the symptoms for each person varies greatly. And essentially what happens in MS is that the body recognises a substance called myelin, which is a fatty substance or lipid-based substance that coats the nerves of the central nervous system, also the spinal cord. The body recognises this as a foreign substance. And what it does, it attacks this myelin. It damages the myelin and it leaves these axons and nerves vulnerable to damage. So what this leads to is clinical symptoms in people with MS, and it could be loss of motor function, it could be visual impairment, it could be bladder problems or incontinence problems, and also fatigue, depression, as well as issues with learning and memory. So the duration of MS, it varies a lot depending on what category each person goes through, but essentially with the RRMS type of MS, people generally will progress onto the more severe forms of MS, so the primary or the secondary forms of MS.
Okay, just to jump more into RRMS or the relapse-remitting MS, what kind of treatments are currently used and what sort of challenges do patients with RRMS face? I understand it's one where symptoms can come and go and new symptoms come in and then might leave for a certain period of time.
Yep, so RRMS is actually the most common form of MS, so about 80 to 85% of people with MS will begin with RRMS. At the moment, there are 2 categories of treatments for people with MS. So the first category is referred to as disease-modifying therapies, so in short, DMTs. And as I said before, MS is classified as an autoimmune disorder. So what these disease-modifying therapies, they target and modulate the immune system. And what that does, it prevents the number and frequency of the relapse. So that's where the individual may suffer from some of the clinical symptoms that I just mentioned before. So those are the DMTs. They don't cure the disease, so it really just reduces, like I said, the relapses and then this clinical symptomology. The other category of medications available for people with RRMS are specific medications that actually treat whether it's fatigue or incontinence or the visual impairment. So those just specifically target the symptoms, but whereas the DMTs try to modulate the immune system to prevent the relapses from occurring more often. Now, in terms of the DMTs, in 2013, that was when the first DMT was available. And right now in Australia, there are about 14 different DMTs, depending on what type of MS you have, that are available. Now, the DMTs, while they're very, very effective at reducing the relapse rates and essentially kind of like puts a Band-Aid on the disease progression, sometimes they do come with some pretty severe side effects. They're pretty invasive, so some of them, whilst they're taken orally, some of them require injections as well, and it's at pretty frequent intervals. So what's really missing, and there's a massive gap at the moment in medical research for MS is to identify a cure. So in terms of how to cure MS, it's really looking at ways to support the myelination process, so that fatty substance that I was speaking about before that coats the axons, the brain cells, to make sure that there's rapid signal and conduction of these electrical impulses between brain cells, which can then communicate to the rest of the body. So that becomes impacted, but right now there's no therapies that can effectively stimulate this process.
Yep. How far have our treatments come in maybe like a 50-year period, and what sort of enhancements in quality of life have people with MS, how's it changed maybe in the last 50 years, just so we get a clearer picture of just how impactful these treatments can be today?
Yeah. So, like I said, in 2013 was when the first DMT was available. However, quality of life for people with MS, I think because how effective some of these DMTs are, it's not as bleak as what it was before, 50 years ago. So we can essentially halt the progression of the disease, but that could be a finite time before it can no longer be prevented.
Okay. How have MRI scans helped us understand MS more clearly, track its progression, and refine how we treat it?
Mm-hmm. So MRI stands for magnetic resonance imaging, and I'm sure a lot of people have come in, either been through an MRI scan or definitely heard of it. There's been a lot of advancements in terms of MRI imaging for medical research, whether it's in animal models, preclinical animal models, and also obviously in research involving humans. So particularly in the very, very early stages of MS, it can be characterized by small lesions, which are called demyelinating lesions. So they light up on the scans that we look at. And there's also changes to other parts of the brain. So white matter is where a lot of the myelin is. There's also grey matter as well. The advancements in the MRI technology, we can pick up very, very subtle changes that weren't previously, that couldn't be detected because of the sensitivity of the scans, and there's different sequences that we can run where we can see how much myelin there is in a particular brain region of interest. It can look at essentially the axon health. And one other component is that sometimes there's changes in the structure of the brain that occurs with MS over time. So sometimes you will see brain atrophy, so shrinking in certain regions of the brain. So MRI is capable of picking that up as well. So it's really, really important for us in medical research to test, well, one, to diagnose, two is to test the efficacy of treatments as well, so we can track either the same animal over time or obviously a patient over time to see whether you've got less active lesions going on, or if you've got brain atrophy happening, or whether that becomes halts totally. And we're able to quantitate those changes as well. So that gives us really meaningful data to see if anything is effective or not.
How could treatments that target myelin, and I understand this is what some of your research is about now, how can they offer new hope or significantly improve outcomes for people with MS?
Yeah. So like I was saying with the DMTs, they prevent further relapses, but they don't specifically target this myelination process. So during the periods of relapse in MS, or RRMS, what happens is the body will actually attack the myelin. So it creates little gaps or damage to the myelin sheath. It's like a membrane surrounding axons. So if you think about like heaps and heaps of cylindrical layers of these lipids, so myelin's rich in lipids, up to 70 to 80% of myelin is comprised of lipids surrounding a wire. So if the body's chipping away at this myelin sheath or this membrane, then the axons will eventually die, and that causes the clinical symptomology. So what our research is focused on is whether can we replenish these myelin lipids. So there were a couple of big studies done a couple of years ago where the researchers collected blood samples from people with RRMS. And what they found was a very particular, a distinct signature. So they measured the over 700 or 800 lipid species within blood, and people with MS had a reduction in some specific type of lipid species compared to normal controls in that study. And for those particular lipid species, they are very rich in myelin as well. And another reason as to why we decided to go down the lipid-based pathway was that it's been historically recognised that oligodendrocytes, so they're a type of brain cell that produce myelin within the brain. So these oligodendrocytes, it was always just thought they can only produce myelin locally. So they only derive the lipids from brain to create myelin and wrap it around these axons. However, there's been a lot of recent evidence that's telling us these oligodendrocytes can actually extract lipids from blood and then incorporate it into myelin. So we have collaborators at the Baker Institute based in Melbourne, and they have this purified supplement which is rich in one of the particular types of myelin lipids. It's really important in maintaining the structure of myelin, in addition to other properties such as being anti-inflammatory. It's also very, very strong antioxidant as well, and it has a lot of other beneficial properties. So our reasoning for targeting or using a lipid-based formulation in an oral supplement to reduce the risk and progression of MS is that if we have a reservoir, so increase the reservoir of these circulating lipids after ingesting the lipids, then that could potentially help with the myelination process, otherwise known as remyelination, where you're repairing and then you're creating new myelin.
Has the use of these oral supplements started in a trial, or is that to come?
That is coming in the next couple of months. So we're currently finishing off some animal analysis of animal data, where we used a mouse model of MS, and we essentially fed these mice with this lipid-based supplement. And what we did see was really remarkable results. So these mice that develop an MS phenotype, so where they've got motor dysfunction, and where they have, so we were able to measure them under the MRI as well, where they've got depleted myelin within the brain, and a number of the other neurodegenerative characteristics of MS. By feeding the mice with this particular lipid supplement, the MS phenotype was almost gone. So they were able to move a lot better, and the myelin homeostasis within the brain was actually repaired. So the next step from here is to start a pilot clinical trial in people with early MS. And then we will be providing them with this lipid-based supplement over a period of time. And again, it'll be a randomized trial. So we'll have people on placebo and people on the lipid supplement. And then we will be able to characterize the changes in clinical disability, fatigue, and obviously the MRI scans as well. So that'll be very telling. So that's starting in a couple of months' time. So we're very fortunate to have received some funding from Multiple Sclerosis WA as well as the Department of Health WA.
Well, so I take it it's a pretty promising result so far.
Yeah, and what's even more exciting about this is that the supplement is very safe and tolerable. So a lot of the DMTs are obviously like pharmacotherapies, hence the side effects. So with this lipid-based supplement, it's very well tolerated in humans, and it's been tested out in a phase 1 trial as well.
Okay. What inspired you to focus your research on MS and specifically on remyelination?
What inspired me to? Well, there's no cure for MS, right? So really my inspiration is to help improve the outcomes of people living with MS. Despite having pretty effective therapies, there are still a lot of people who undergo the debilitating consequences of MS without this cure. So I think it's really, really important that working together with other researchers that we can find a therapy that is effective in remyelination, and that hopefully will solve the MS problems.
Yeah.
Yeah.
How do you see, as someone who is obviously really invested in working in MS, how do you see the next 20, 50 years for MS treatment?
There's been, the MS field has evolved really quickly, particularly in the last 10 years or so. I'm hopeful within the next 20 years there will be a lot of therapies that will be available to people with MS. And mind you, I was talking about the DMTs before, but a lot of them are only available to people with RRMS. So it's more people who have progressive forms of MS where there aren't a lot of effective treatments. And why is that? It's mainly because the ability to remyelinate actually becomes less and less the longer you have MS. So the greater the remyelination that occurs, the less clinical symptomology that's going to occur. So the earlier you get in and treat will help you prevent from getting worse.
What would be involved in an early detection or identification of MS?
Will be involved. So there's pretty sensitive assessments you can do within the clinic. So whether it's a disability assessment, but that's where the neuroimaging is really important. So with the MRI imaging, that's probably the most important assessment that you can do. But in saying that, the clinicians always look at both the clinical assessment plus the imaging data as well.
Would there be anything specific that you would tell people? Because I understand a lot of MS symptoms are also symptoms for other things. They're not exclusive.
Yeah.
But could there be something that maybe is a little more specific to MS that if someone experiences, maybe it's time to ask your doctor about that?
Yeah. There are, like you said, it's very non-specific. But sometimes if there's like a bad bout of pins and needles, sometimes it could just be you've just got just loss of vision for a couple of seconds. I think it would be really important just to go and see the doctor about that, because that could be a precursor to the so there's two different forms. There's the clinically isolated syndrome where there's just one demyelinating event and you might not get any other symptoms for about 5 or 10 years.
What might one of those events be?
So it could be just loss of vision for a few moments. It could be blurry vision. Could be just a bit of tingling in your extremities. Yeah. It is very non-specific, and that's why it does become undiagnosed for some people for a while.
Yep. Okay. And could you share any key moments or findings in your research that's helped shape the direction of your work in MS?
Key moments. I'd say it would be based on the animal data that we have generated. So one of our PhD students and the rest of the research team, we've basically completed a really, really big series of experiments where we've looked at the different neuromotor function and then some of the other measures, whether we look at it in the MRI scans or whether we use confocal microscopy to measure whether it's myelin, whether it's axon health, whether it's blood-brain barrier damage. One of the key moments was when we were looking at the pilot data, the preliminary findings, and we saw it's like, oh wow, this actually might be working, one of the treatments. So, and that's what really drives our research, to be able to translate the findings to hopefully progress onto a clinical trial.
Awesome. And finally, could you describe what you and your colleagues are focusing on at the moment?
Yeah. So in terms of the MS project, so our group focuses on a number of other neurological disorders, but relative to MS, we're about to embark on this pilot clinical trial that will be hosting at the Perrin Institute. So that's in Netherlands. So that'll be the main study site. So we want to get that set up. And we're continually expanding on some of our animal experiments to look at other types of therapies, whether it's lipid-based, whether it's another kind of pharmacotherapy.
Great. Awesome. Thank you, Virginia, for joining us.
Thank you so much for having me.
You've been listening to The Future Of, a podcast powered by Curtin University. If you've enjoyed this episode, please share it. And if you want to hear more from our experts, stay up to date by subscribing to us on your favourite podcast app. Bye for now.